Welcome back to our educational series on genetic disorders. Today, we're going to delve into the fascinating world of Fragile X syndrome. So, let's get started. Fragile X syndrome is a genetic disorder that affects the X chromosome. It is the most common inherited cause of intellectual disability and autism spectrum disorder. Fragile X syndrome occurs due to a mutation in the FMR1 gene, which leads to a reduction or absence of a protein called FMRP. This protein plays a crucial role in brain development and function. The symptoms of Fragile X syndrome can vary widely, but there are some common features. Individuals with Fragile X syndrome often experience intellectual disability, learning difficulties, and delayed speech and language development. They may also exhibit behaviors such as hyperactivity, attention deficit, and social anxiety. Physical characteristics can include a long and narrow face, large ears, and flexible joints. The FMR1 gene is a gene found on the X chromosome, which plays a crucial role in normal brain development and function. It provides instructions for producing FMRP protein. In individuals with Fragile X syndrome, there is a mutation or alteration in the FMR1 gene that leads to a reduced or absent production of FMRP. The absence of FMRP disrupts the normal functioning of neurons in the brain, which contributes to the symptoms and characteristics associated with Fragile X syndrome. Prevention of Fragile X syndrome is challenging since it is a genetic disorder. Genetic counseling can be helpful for families who are planning to have children, as it can provide information about the risk of passing on the condition and options for prenatal testing. The assessment of Fragile X syndrome involves genetic testing to confirm the presence of the FMR1 gene mutation. This test can be done through a simple blood sample. Early identification of Fragile X syndrome is crucial for timely intervention and support. Although there is no cure for Fragile X syndrome, various treatments and interventions can help manage the symptoms and improve quality of life. These may include medication to address specific symptoms like anxiety or attention deficit, behavioral therapies, speech and language therapy, occupational therapy, and specialized educational programs. Education plays a significant role in the lives of individuals with Fragile X syndrome. It is essential to create an inclusive and supportive environment where individuals with Fragile X syndrome can thrive. Specialized education programs and individualized educational plans can help address specific learning needs and support their overall development. When it comes to intervention, it's important to take a comprehensive and multidisciplinary approach. A team of professionals, including doctors, therapists, educators, and psychologists, can collaborate to provide tailored interventions based on the individual's strengths and challenges. Fragile X syndrome is a complex condition, and its intricacies go beyond the surface-level symptoms. Research has shown that individuals with Fragile X syndrome may also experience sensory sensitivities, difficulties with executive functioning, and challenges in social interactions. Understanding these intricacies is vital to provide appropriate support and interventions. One misconception is that all individuals with Fragile X syndrome have severe intellectual disabilities. However, the intellectual abilities of individuals with Fragile X syndrome can vary significantly, ranging from mild to severe. It's essential to recognize and appreciate the unique abilities and strengths of each individual. Another misconception is that Fragile X syndrome only affects males. While males are generally more severely affected, females can also be carriers of the FMR1 gene mutation and exhibit symptoms. It's important not to overlook or underestimate the impact on females with Fragile X syndrome. Living with Fragile X syndrome requires a supportive and understanding environment that promotes acceptance and inclusivity. It is essential to focus on individual strengths and abilities while providing tailored support and accommodations to address specific challenges. Building a strong support network and accessing resources, such as therapy and educational programs, can greatly enhance the quality of life for individuals with Fragile X syndrome. By embracing a person-centered approach and fostering a sense of belonging, we can create a nurturing environment that empowers individuals with Fragile X syndrome to thrive and live meaningful lives. That brings us to the end of our video on Fragile X syndrome. We hope you've gained a deeper understanding of this genetic disorder. Remember, by dispelling misconceptions and providing support, we can make a positive difference in the lives of individuals with Fragile X syndrome. Thank you for watching, and we'll see you in the next video.